My name is Wilma Varela, aka Dr. Lovetro Gilbert today. All right, so today we're going to be learning about acute kidney injury, okay? So first we're going to analyze a question. We're going to look at a question. And the question is about AKI, acute kidney injury. For the patient with AKI, which laboratory results would cause you the greatest concern? So what are we looking for here? We're looking for the greatest concern when it comes to that laboratory result, when you're looking at that laboratory result. So before even looking at the answers, let's go over a little overview about AKI. So AKI is a sudden episode of kidney failure. So sometimes you hear it referred to as kidney failure, okay? It causes a buildup of waste products in the blood. It makes it hard for the kidney to balance fluids in the body. So we can imagine it causes electrolyte imbalances in the body. It affects other major organs such as the heart, the lungs, and the brain, okay? So now, what laboratory results are concerning to us? What are we looking at when we look at that laboratory result? Well, we suspect AKI first when we see that decrease in urinary output and also an increase in BUN and creatinine. And also, there will be a progressive acidosis at that point. Now, like I said, the electrolyte is imbalanced in the body. So what are we looking at? What are we most concerned about? First off, we're concerned about this hyperkalemia, which can be fatal in leading to cardiac dysrhythmia. And we're also concerned about hypokalemia. The patient, the child will be anemic, they will have an anemia, and an increase of phosphates and calcium in the blood. So everything is thrown off at this point. I guess we can now look at the answers. Now the answers are A pH of 7.5, all right? Now, is this a normal range? It's a little elevated because the pH level of a blood is 7.3 to 7.4, right? B, now we concerned about that? Not too much, right? B, a BUN level of 25. As we mentioned, BUN, an elevated BUN, we start suspecting the AKI. Now, is that a concern? It's not. It only indicates that kidney, there's a kidney disease there. And C, sodium level of 144. Now, that's a stupid cross out. Let's just cross that out. It's stupid, okay? Because this is a normal level. We know that the normal level of sodium is 135 to 145. Stupid cross out. All right, in D, potassium level of 5.9. That's an elevated potassium level. We know the potassium level is 3.5 to 5. So are we concerned about this? Yes, we are, because we mentioned the cardiac dysrhythmia when it comes to AKI. So our answer is obviously D. All right? Now the rationale is simple, as we mentioned. Hyperkalemia is one of the most serious complications in AKI because it can cause life-threatening cardiac dysrhythmia.